Mary Roach's novel Stiff, The Curious Lives of Human Cadavers provided America with a gross and educational exposure of life after death and those who chose to give themselves to science. Roach takes an abrupt and comical approach to this dark topic. Today I'm going to show you all a bit about the history and importance of cadavers today, encouraging you all to consider body donation after death. Body donations to science provide pertinent medical information that is potentially life-saving. For 2,000 years, cadavers, some willingly and unwillingly, have been involved in science's boldest strides and weirdest undertakings. Dissection is performed as part of a post-mortem or autopsy. Post-mortems were practiced dating early from the late 1800s. The purpose of post-mortems were to support the physician's diagnosis made when the patient was alive. It also helped physicians to learn about the internal symptoms and signs of disease. Today, post-mortems are commonly thought of as part of a forensic and criminal investigation. Medical schools for training for more than 2,000 years have used cadavers. Over this period of time, the methods of acquiring and preserving them have changed. Criminals who were executed for their crimes were used as the first cadavers. As the number of criminals being executed decreased, it became commonplace to steal bodies from graves in order to keep the market supplied. The tradition of dissecting criminals continued into the 18th and 19th century when anatomy schools became popular in England and Scotland. Anatomy schools began to steal bodies from graves. Grave robbers were technically people who stole jewelry from the deceased, but stealing a dead body was not a crime. Some anatomy instructors encouraged this body snatching. Sometimes students paid in tuition in corpse or dug up bodies as late-night pranks. Some respected anatomists dug up bodies themselves. In fact, the anatomist Thomas Sewell, who later became the personal physician for 3 U.S. presidents, was convicted in 1818 for digging up a corpse for dissection. Anatomists would even dissect members of their own family. William Harvey, the man famous for discovering the circulatory system, was known for dissecting his father and sister. The public was well aware of grave robbing. They often referred to perpetrators as night doctors, sack-em-up men, body snatchers, while anatomy professors considered them resurrectionists. Commonly, a guard was hired or family members took turns to watch over the graves the first few nights after burial. The graves most likely to be robbed were those of poor, unprotected members of society, much like African Americans. Embalming and preservation of cadavers became more advanced, and education in medical schools improved. Students no longer had to quickly dissect bodies before the bodies decomposed. By the end of the 18th century, the U.S. government began to realize that a dramatic legal change would be necessary to effectively end the practice of grave robbing. Until medical schools had a good alternative for cadavers, there would always be a market for illegally obtained bodies. Massachusetts was the first state to enact laws in 1830 and 1833 allowing unclaimed bodies to be used for dissection. This led to a wave of states following suit. These unclaimed bodies came from hospitals, asylums, and prisons. These bodies were then allocated to medical schools in the most need. This started the decline in grave robbing. Still, some states forbade dissection of the unclaimed body of travelers, presumably allowing for the time it might take for a traveler's family to reach the body. At the turn of the 20th century, most Americans disapproved of dissection, and voluntary donations were quite rare. There were religious objections to dissection, and it was now associated with unclaimed bodies and therefore a mark of poverty. There were a few notable exceptions. A wealthy man named Thomas Orne, a prosperous horse dealer who donated his body in 1899, according to the local newspapers, had no concern that the donation of his body would signify that he lacked the means for a proper burial. In addition, citizens with unknown medical ailments sometimes wished to donate their bodies in order to aid those with similar diseases. In 1912, 200 New York physicians publicly pledged to donate their bodies after death in an effort to remove the stigma associated with dissection. While these small efforts promote a positive view of body donation, the biggest push for society was to reconsider the funeral home. In 1951, Bill Davidson wrote an article called The High Cost of Dying, in which he noted that the previous 120 years, while the cost of living had increased by 347%, the cost of dying had increased by 10,000%. In 1961, Raoul Tunley's article, Can You Afford to Die?, said that the country's annual funeral costs were much higher than its annual hospital costs. Around the same time, Jessica Mitford's book, The American Way of Death, detailed the scams and price-fixing practices in the funeral industry. In order to avoid high funeral costs, Mitford recommended that people donate their bodies to science. Despite the successful promotion of body donation, medical schools' high demand for cadavers still requires many schools to use unclaimed bodies, particularly in states with multiple medical schools. While many schools have incorporated computer-based learning tools in their courses in anatomy, these tools are still viewed as a supplement for dissection, not a substitute for it. Students are much more comfortable believing that the person when alive had authorized his or her own dissection rather than it being authorized by a medical establishment. There was a time when an anatomical dissection became only whether when the donor or the recipient had committed a crime. In our times, the same act is viewed as a privilege. One of the chief advantages related to donating your body to science is that this option is considerably less expensive than the other funeral options. By donating your body to science, you avoid costs associated with body burial in a cemetery. A body donation can also be fairly simple to arrange. Normally, you file basic paperwork with the death program and then notify that donor program following the death. Representatives from the medical school will dispatch professionals to pick up and transport the body back from the medical school. The donor program or medical school accepting the body usually takes full responsibility for handling the eventual cremation and burial tests. Donating your body to medical science also has an altruistic advantage in that your donation helps train future doctors and surgeons in finding cures to a variety of different diseases. While this may not be a high priority in some families, other families take solace in the fact that they are able to make a positive change on medical advancements. Facilities accept donations provide a free cremation, which typically costs $1,500 to $3,000 and generally returns the ashes in 3 to 4 weeks. Body donation is essential to the advancement of medicine because it provides a way to study and cure debilitating conditions and diseases affecting mankind today. Donors contribute to advanced physician training, development of assistive medical devices, studying diseases, and training medical personnel. There are many ways to donate your body to science, whether it be through a nonprofit or for-profit organization. Organizations like Medcure, American Association of Tissue, universities like Johns Hopkins, Stanford, and Cleveland, and many more accept body donations. Without body donation, the knowledge of anatomy and the advancement of medicine would not be as it is today.